Health Connection, medical assistance for all.
A health awareness initiative by Health Connection.
Acute heart attack. An acute heart attack, also called a myocardial infarction or MI, is a medical emergency. Having an MI means that one of your coronary arteries have become suddenly blocked and the heart muscle supplied by that artery are beginning to die. There are two kinds of risk factors that lead to an acute heart attack. Non-modifiable, including increasing age and gender, and modifiable, high blood cholesterol, high blood pressure, physical inactive, obesity, stress. Symptoms: the heart attack may manifest with a sudden onset severe central chest pain described as heavy compressing pain, which can radiate to the left hand, jaw, or the back.
It is often associated with profuse sweating and weakness.
1 of every 3 patients who develop acute heart attack suddenly die.
We thank Dr. Sanjeev Chaudhary, Director of Cardiology, Fortis Memorial Research Institute, Gurgaon, for explaining acute heart attack and supporting our initiative.
I am Dr. Sanjeev Chaudhary. I am working as Director Cardiology in Fortis Memorial Research Institute, Gurgaon. Today I am going to talk about the most feared disease available, that is acute heart attack. We all know that acute heart attack can be catastrophic, it can be life-threatening, and we all should know that 1/3 of patients who develop this acute heart attack, they die suddenly, they are not able to reach the hospital. So, whenever you have chest pain, never ignore it. Always consider it to be a cardiac pain. Let the doctor decide whether this is a cardiac pain or a non-cardiac pain, meaning thereby whether it is related to heart or not. Whenever you feel this kind of pain, the first and foremost is to take a total 1 tablet of Disprin and chew it. Drink water over it, rush to the doctor, get the ECG done. In this disease, time is the essence. The sooner you reach a well-equipped hospital, the sooner the artery which is blocked and it is causing the heart attack is opened up, the better it is for you. If you reach the hospital within half an hour and the artery is opened up, the total heart attack can be aborted. You may have no consequence whatsoever of the heart attack. But once you delay it, you try to diagnose it yourself, you don't reach the hospital, you don't take medical help, then a single heart attack can lead to such a dysfunction in the heart that your whole life can be very troublesome. You may feel breathless while doing normal work, and then there is no remedy for it. There are many myths considering the heart involved in the heart diseases. The first and foremost myth is that this heart attack cannot happen below a certain age. I must tell you that we have seen patients suffering from acute heart attack, dying from heart attack with ages as less as 25 years. So never think that in this age the heart attack cannot happen. Heart attack can happen at any age. And the other myth is that my blood pressure is normal, I cannot have a heart attack. See, try to understand, there are 2 types of risk factors for heart disease. One is modifiable, one is non-modifiable. The non-modifiable risk factors include the genetic composition, and which you cannot do anything about it. So it's better to get yourself checked, check yourself regularly and be aware of your cardiac condition. Now, how to get yourself checked and how to prevent the heart attack? Everybody should get his lipid profile after the age of 20, and if it is normal, it should be repeated every year or maybe every 2 years. The other test which is mandatory is an ECG and a treadmill test. The other myth is that once you have a normal ECG, one tries to consider that he has no heart disease, whereas 33% of patients who have normal ECGs can develop severe heart attacks within 1 year. So always get a treadmill test, which is a very simple exercise stress ECG in which we can find out how your heart is going to behave when it is put under stress. In this way, we can very easily diagnose the disease without and before it causes a major problem. So everybody should get a treadmill test after the age of 35 and preferably every year. The other test which is done routinely for cardiac condition is echocardiography. Now try to understand the difference between a treadmill test and an echocardiography. Echocardiography is seeing the heart by an ultrasound, so this gives us the structural condition of the heart, and treadmill test, which I have discussed before, gives the functional capacity of the heart. They both are complementary, and echo should also be done along with TMT at least once, and if normal, should be repeated after every 5 years. If TMT is abnormal, which tells us that there is a blockage, it cannot tell us how much percent is the blockage. For that, angiography is required, which can clearly tell us the percentage of blockage, and if the blockage is more than 70%, then that should be treated. The main aim is that we should try to diagnose and treat the blockage before it causes muscle dysfunction or any significant damage to the heart. By doing this, everybody can remain heart healthy. Otherwise, for prevention, the most important thing is exercise. One should exercise at least 30 to 45 minutes a day on most days of the week, and that can always make you healthy. It can improve your heart condition. Even after patients who had undergone angioplasty or bypass in the past can exercise and should exercise. Last but not the least, the only thing which a patient should not do to prevent heart disease is smoking. So main two factors which can help you lead a healthy heart life is avoid smoking and exercise daily. First and foremost advice is to, whenever you feel chest pain, rush to the hospital, get medical help as early as possible, and by doing that you can save a life. Try to disseminate this information to your friends and neighbors and ask them to follow the same protocol, and ask them to rush to the hospital whenever you feel chest pain. Let the doctor decide so that a life can be saved. Thanks.
Special thanks to Mr. Sudhir Gopalia and the management team of Fortis Hospital in association with Health Connection.
Medical disclaimer: the information in this video is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. All content, including text, graphics, images, and information, contained on or available through this video is for general information purposes only. It is not intended as medical advice, and should not be relied upon as a substitute for consultations with qualified health professionals who are familiar with your individual medical needs. The whole sole purpose of this video is to make people aware of healthcare and medical knowledge and developments. We at Health Connection specially recommend you to visit an authorized physician nearby for medical opinion, medication, treatments, or procedures. For more details, kindly visit our website www.healthconnection.in, or if you have any questions, comments, or concerns, please do not hesitate to write to us at info@healthconnection.in.